says Jane Doe is gonna insert it in G2 to check her medical history, make sure she has no facial trauma, nosebleeds or any surgery, and it looks like she doesn't, so we're gonna go in. Knock knock, good morning Jane, my name is Carolee, I'm gonna be your nurse today. Can you verify your name and date of birth for me? And she does. The doctor has ordered an NG tube to be placed this morning. She says, yeah, he told me. Do you have any questions or concerns about the procedure? And she says no. Okay, so we're gonna do an assessment, check your abdomen. Okay, Jane, I'm just gonna take a look at your nasal passages, make sure you have no obstruction or any swelling or polyps. Okay, we're gonna check your gag reflex. Okay, and she's got a good gag reflex. Okay, Jane. Set that there. Keep your head up, okay? Okay, Jane, what we're gonna do, make sure I check the package before I open it, make sure it's not compromised or hasn't been opened prior and put back or something, so the package is good. Okay, Jane, what we're gonna do is you take this tube and we're gonna go down your nasal passages, okay? And we're gonna keep your head tilted back like this. And then we're gonna go down through your throat. And then when I tell you, we're gonna keep your face forward, and then you're gonna drink water and keep swallowing while we keep going down, okay? And she says, okay. Alright, I'm just gonna keep this on just to monitor your O2 sats while you do this. Make sure I got suction ready. Just reading it. You got an Emesis basin, Kleenexes. We're gonna hold your water, so I'm just gonna measure this first. Put it in there, but I don't have a package. Oh, here. Just lube the end. Okay, Jane, are you ready? And she says yes. Let's get it done. Okay, we're gonna tilt your head back, okay? And just take deep breaths through your nose or your mouth. I'm sorry. There you go. Jane, I'm sorry if you have any discomfort or want me to stop, just raise your hand, okay? And she said, I would tell her that prior before putting it in. Okay, Jane, push your head down, drink some water and swallow. socks are still good. Just mark below the nearest, so in case if it moves. Good. Tear some tape off prior. Have the tape ready to go before tape this on your nose. It's not gonna stay, so we tape it on her nose, and then we can tape it to her gown. Okay, it's not gonna stay, but okay, Jane. Tape won't stay. Okay, I'm gonna take a listen here. Your breast sounds. Sounds good. Okay, and then we hook this end up to the suction or the feeding tube. Let's send her down to X-ray, make sure to check the tube placement. Check for the pH levels. That's hooked up. Then we put it in a cup and use the pH strip and check the pH and make sure it's between 1 and 5. Looks good. Okay. She has a feeding tube to prevent aspiration. We make sure we keep the bed 30 degrees or higher. If we have to turn her or put her head down for any reason, we make sure we pause the feeding tube before we lay her flat. If she's eating, we encourage small bites. We can also do a chin tuck, and if she has any difficulty swallowing, we can call a speech therapist. They can do a swallow study, and we make sure their head of their bed is up 30 degrees or higher after eating, 30 minutes after eating also for 30 minutes. Okay, Jean. And then we'll come back and check on you a little later. And she says, okay. Okay. Now, and then check my orders. I got an order to DC the NG tube. So we're gonna go in. Knock knock, hi Jean. It's Carol Lee. You're gonna be your nurse again today. You verify your name and date of birth, and she does. I got an order to take the NG tube out, and she says, oh, that's wonderful. And then after, I forgot to mention this, but after I put the NG tube in, I make sure I chart the procedure. I chart how she tolerated it, and then if she was hooked up to suction, we make sure we chart every shift about how much output she's got in there, every shift. Okay. You ready to get that tube out? And she says yes. Washcloth here, but we'll use this. Got some Kleenexes and an MSS base in case you need it. She says, okay. her hand. She says, okay, do you have any questions or concerns before we start? She says, no, just get it out. Okay. Let's take the tape off. We unhook it from her gown. Okay, Jane, you're gonna have some gating as we pull it out, okay, so if you need to, I got Kleenexes here and I got your Emesis basin, and she says, okay. Alright, so what we're gonna do is have you take a deep breath through your mouth when I pull it out, okay, and she says, okay. You make sure to check the end that's there, and then just go ahead and throw this away. Wipe it off, Jane. You did good. And she says, thank goodness that thing is out. I'm just gonna go ahead and do an assessment. I can. Breath sounds good. Check her abdomen. Okay, now Jane, now that we have that tube out, you can lay your head down again, and she says, thank goodness, I got tired of sitting up. She says, that's comfortable enough there. Okay, Jane, anything else I can get for you? She says, no, I'm just gonna rest.